Oh yeah, I guess it really don't matter. That's too much riffraff. Oh my goodness, sorry. See. Community acquired pneumonia, which is CAP, is caused by strep pneumonia, chest x-rays, diagnostic. You'll find consolidation, increased tactile firmness, 99, 99, 99, 99 with vibrations. Treatment is macrolides, amoxicillin, doxycycline, levaquin. If comorbidities exist or they've recently had macrolides, amoxicillin, or doxycycline, then you move on to levaquin. And then the next step will be combo augmentin and immaculate. Unilateral bronchi, wheezing. Okay. Was I doing questions? I was doing some questions. Okay, so see. An infant patient is brought to the clinic by their parent who reports that the patient is spitting up more than normal. The nurse practitioner suspects that the patient may have GERD, which is a risk factor of this condition. Recent airway disease, cesarean delivery, breastfeeding only, cystic fibrosis. I would think cystic fibrosis. Okay, cystic fibrosis it is. So we're just gonna put cystic. Hard to see what? Hard to follow. Oh shit. Okay. I didn't even say shit. But cystic fibrosis is a risk factor for GERD. Think GERD. Why, Deandra? Why is cystic fibrosis a risk factor for GERD? Infants with cystic fibrosis are an increased risk for GERD. GERD usually resolves on its or GER usually resolves by 1 year of age. The term GERD is used when the reflux has pathologic consequences such as esophagitis, nutritional compromise, or respiratory complication. Um, So management for I don't know, this management for six oh no, it's management for GERD, I guess. Avoiding tobacco smoke exposure, avoiding overfeeding with smaller frequent feedings, use of thickened feeds, positioning therapy, keeping the infant upright for 20 to 30 minutes after feeding. Can't use, not necessarily, well, I guess PPIs and H2 blockers are generally not recommended for infants. For complicated cases with underlying disorders, refer to a specialist as necessary. I'm always going to refer. That's what I'm going to do. An older adult patient presents to the clinic with reports of dysphagia. Which two cranial nerves are responsible for the function of swallowing? Okay, I would think 12 would be one of them, right? Probably ain't. 12 is the tongue. That's why I was thinking 12, but I could be wrong. Glossopharyngeal and vagus, which is 10, 9, and 10. It's, that's good to know. I gotta read the rationales because the rationales really do help with other questions. Duh. All you gotta do is say yes. All you gotta do is say yes. So that's why this music shouldn't be up that loud because now I'm singing it. I'm about to let you know. I don't like these questions like this. The nurse practitioner reviews the findings of a randomized controlled trial that compares the effectiveness of a new diabetes medication to metformin, which is glucophage. What is the characteristic of a randomized control trial? A randomized controlled trial. Oh, that's not what I said. Randomization allows for a true comparison between groups and removes bias in a RCT. Randomizing two groups of people, bias is removed and a true comparison can be obtained. Child wit. They always want you to know about these RCTs, man. I think that's the best type of research, though. RCTs remove bias. Mm. Removes bias for a true comparison. True comparison. So, randomized controlled trials and drug approval process. FDA approval process. The Food and Drug Administration requires new drugs or treatments to pass randomized control trial to prove their safety and effectiveness before distribution to the public. Researchers and pharmaceutical companies backed by financial interests, aim to prove the effectiveness of new drugs or treatments. Reliability. RCTs are considered the most reliable method for testing new drugs and treatments. It is the most reliable. That sounds highly testable. So it removes the bias, allows for a true direct comparison between groups. Limitations of animal research. Some drugs have caused harm in humans when trials were based solely on animal research. Non-human animal responses are generally poor predictors of human responses to drugs or treatments. Uh-oh, I didn't do that. Why did they do that? I'm not done. I was not done with my questions. That's crazy. This sandwich right here? Oh, I'm going. This is not. This tough. Yeah. I'm about to write on something. Bothersome. Guess I just steady for like just read now. Huh? That wasn't the plan. I like doing questions. I love doing questions. I love doing questions. I really do. What does that mean? Hey, Quenisha. Hey, Cameron. You like this music selection? Thank you. It's so crazy. It's too loud, but the remote is too far away. I ain't even finna change it. I can't even. So let's see. What did we learn today? Hey, KL. Thank you. Y'all come in and go to work. See, I don't even have to tell y'all nothing no more. I love that. I do. Initial treatment for hypertension in a black patient. I think the answer would be a thiazide diuretic, like hydrochlorothiazide. I think that's really the number one answer. And then like the next choice would probably be a calcium channel blocker. If you're testing ACL, you're gonna do a Lockman's test. Secondary prevention after a TIA would be aspirin or Plavix. Plavix is expensive though. Aspirin. You can't prescribe your patient Plavix knowing they on a fixed income. Okay, they're not gonna pick it up. Yes, Plavix may be better. I don't know for sure, but I'm just this is just an example. Plavix may be first line, but they can't afford it, so they don't get anything. You don't want that, so you give them aspirin. Diabetic man with intermittent leg pain while walking, you will put him on aspirin too. He's suffering from claudication. What do you tell your patient who's been on an antidepressant for 3 weeks and they don't notice much of a change? You tell them to keep on going because it takes about 4 to 6 weeks for it to kick in. Mm, I'm just kind of going through some of the stuff I went over today. Um, oh, this is a questionable one. Lyme disease not improving. What do? They still have that post Lyme disease, those post Lyme disease symptoms. So you can't just automatically start give more antibiotics. You have to kind of give it time. But if they start having new symptoms, it's one thing that the symptoms aren't gone versus new objective findings, like some type of neurologic deficits or something, or cardiac issues. Then you would give Rocephin, I think. But you have to give it time. Like Lyme, like Lyme, Lyme disease from ticks. Most common community acquired pneumonia organism is going to be strep pneumonia. You're going to do a chest x ray. Consolidation will be present. Patient will have increased tactile firmness. How you check for, you so silly. Tactile firmness, you do the 99, 99, 99. Do I have a tongue tie? Well, I wasn't breastfed, so I guess it don't even matter. Sorry. My mama bottle fed me. I was given Similac with iron. I was a big baby. I think I intimidated her. Mm. Anyway, but if I would have been there for my mama as a lactation consultant, as a nurse, my mom would have breastfed for 12 months. Hmm. Bronchitis is 95% viral. Don't prescribe antibiotics because sputum is green. Don't prescribe antibiotics just because sputum is green. I can't even pull up my thingamajigger. Only classic board antibiotic indication is for pertussis, and that's azithromycin. Look at my thingamajiggers. Pertussis is busy, baby. Okay, bilateral bronchi and crackles on auscultation for bronchitis. We do not treat based on sputum color. 95% of bronchitis cases are viral. The chief complaint is a dry, hacking cough. Early symptoms start as a dry cough. Later symptoms are a wet, productive cough after a few days. Initial treatment is symptomatic care. So you can do a inhaled corticosteroid, a SABA, or OTC expectorant. When do you start antibiotics? For your exam, know that we only treat with antibiotics when bronchitis is due to pertussis. Okay. And when we treat it with azithromycin. Oh, and we use the curve 65 to see when to admit older adult patients. So I like that. I did. So let's do bronchitis. I finally found my jam. I'm doing cram notes because I am a crammer. So listening to all that stuff, like I can do my cram notes, and then like when I'm on the way somewhere, I can listen to Sarah Michelle or Latrina Walden. But to listen to them like I'm sitting in class again and then try to write that stuff down and answer questions, that's just a lot. I gotta answer these questions first, learn it, and then let them kind of seal the deal. That's what works for me. I have to kind of do it backwards. So that's how I do it. Um, so bronchitis, bronchi and crackles on auscultation. They sound bad, but you don't see anything about. wheezing. It's coughing. Chief complaint, dry, hacking, cough. It's a CC. And then later symptom is a wet, productive cough, wet or productive. I hate when I run out of my free questions because I'm being cheap. I am gonna end up paying for FNP mastery and the AANP practice test. I got to because I love a practice test. Initial treatment. Now, why is Mariah singing? I be want to listen to instrumentals. Initial treatment is symptomatic care. So we got FCS, SABA, OTC, expectorants. Only give antibiotics with pertussis. And that antibiotic is going to be azithromycin. So, um, Herb 65, confusion, BUN greater than 19, respirations 20 to 30, BP is less than 90 over 60, age is greater than 65. Screening tool used for admitting elderly patients to inpatient hospital care can't tolerate respiratory illness well as healthy younger patients. 2+ could be admitted, but greater than 3 must be admitted. That's good to know. Herb 65, confusion, BUN greater than 19, respiration greater than 20 to 30. That's high. BP less than 90 over 60. Age greater than 65. Age. So 2 greater than 2 can admit. 3+ must admit. Hmm, I don't know what a contract is. What does a contract mean in realtor or what is it in real estate called? that's nice. I'm supposed to be studying. I'm finna study. I just need to respond to this real quick. I just don't understand stuff. Da, da, da. I hope I didn't lose my place. Yes, I did. Okay. Where was I? I got so much stuff in here. Okay, let's see. Microvalve prolapse. What are we thinking? We hear that apex and a mid systolic click. So apex and mid systolic click for mitral valve prolapse. You can't give doxycycline to pregnant women. Can cause yellow teeth in the baby. Ooh, I'm gonna have to do an asthma one later. So a 5 millimeter. What it is say? That's diagnostic for a HIV patient or recent TB exposure or any immunocompromised person. 10 for a healthcare worker, recent immigrant, high risk groups. So that's how, okay, that's easy. 15 is for a healthy person with no risk factors. 5, 10, 15 when it comes to the Mantoux test. Mantoux. Upper lobe infiltrates, think TB. TB gold standard. It's a sputum culture. PPD is safe during pregnancy. So I'm having a little moment here. Mantoux test. Yes. Mantoux, Mantoux. Oui, oui. The Mantoux test. Five. Okay, let's see. 5, 10, 15. Mantoux. 5. Immunocompromised slash exposure. At risk groups. It's going to be healthcare workers, immigrants, the jailhouse. I'll be thinking about that. That's probably not right. Anyway, 15 for a healthy person with no risk factors. Healthy with no risk factors. Another sheet. Complete. Let's start another. Upper lobe infiltrates. Think TB. I don't like doing asthma and COPD right behind one another because I just don't. COPD. What do we need to remember with COPD? I wish I could bring it up on my computer. Diagnosis for asthma is symptoms and spirometry. Spirometry is gold standard. Oh, I do remember that. I'm gonna start back reading. I'm sorry. It's fine. No, I had all these things on the photos. Oh, I want to put all these in there. I don't feel like it right now, but I will. At some point, oh, that's a lot. Why am I going all the way back there? Just put in long on my phone because I'm wasting time and energy. Because at some point, I'm gonna crash because I've had too much caffeine today. Anywho, okay, we got bronchitis, we got TB, we got CAP. Okay, COPD refers to a group of diseases that cause obstruction of airflow and breathing related problems, including emphysema and chronic bronchitis. Emphysema and chronic bronchitis. I almost said I missed clinical. Hey, Darian. Greatest risk factors: older age and cigarette smokers. Hey, girl. Diagnosis. Okay, no. Diagnosis is FEV1, FVC ratio than 0.7, less than, mm, which is 70%. Okay. So we got emphysema and chronic bronchitis. So COPD health maintenance. You want to help them stop smoking, and they need an annual flu vaccine. Okay. Number one, stop smoking. stop smoking, and you need your flu vaccine because if you get the flu, you're gonna be sick as a dog. Flu vaccine. Inflammation of the airways and mucus hypersecretion, known as blue bloaters, cyanotic, overweight, bronchi, and wheezing. Oh, so that's why they always, well, both of them always coughing. Let me see. Air trapping. Emphysema is destruction of the alveolar wall from hyperinflation. So, emphysema is hyperinflation. Chronic bronchitis are the blue bloaters. The airways are inflamed, so they make a lot of mucus. Yuck. So that's what it makes me think of. That's not a realness. And then the okay, patients with emphysema are the pink puffers, dyspnea, older and thin, hyperinflation. I got, I'm gonna remember this because I definitely saw someone. I said, "No," he was on his. Let me hush. He looked blue though. Yeah, I can remember that blue. And I'm gonna say Bill is the blue bloater with chronic bronchitis. Bill has chronic bronchitis and he's a blue bloater. Yep. Let's see who's gonna have emphysema. Pink. Penelope. Penelope has emphysema and she's a pink puffer. Penelope the pink puffer. Oh, Penelope is pretty. I don't want to do Penelope. Anyway, Paula. Paula sounds like she's been smoking for years. Paula sounds skinny with wrinkly skin. I like that. I like that. Mm-hmm. Okay, got it. Let's do chronic bronchitis. I had to get it up here before I write it down. You know, chronic bronchitis is inflammation of the airways. COPD is not reversible. I just put that out there. Mucus hypersecretion. I didn't post a video today. I've been replying to comments so much. I cannot. Okay. Blue bloaters. Cyanotic. Overweight. Bronchi. And wheezing. Bill. We're gonna call him. Then we got M. We have the pink puffer, Paul Ann, yes, Paulette, Paul Ann, because she named after her daddy and her grandmother. Pink puffer, dyspnea, older and thin, hyperinflation. Okay, so barrel chest with the blue bloaters, barrel chest, productive call, finger clubbing. Okay, so barrel chest, increased AP diameter, productive cough because of progressive dyspnea, and finger clubbing due to chronic hypoxemia. Well, you know what? I don't like that. It's probably something you did. Let me delete that comment. I need to block this account. I'll block this account. I ain't gonna do it this time. How about you went off on that sweet baby? Did she pin it? She probably meant to do that. Oh, what? What she say? She, she didn't mean no harm. COPD taking up a whole page. I don't know if I like that. She didn't mean to. Nah. Shoot. So for COPD exacerbations, you have dyspnea, sputum production. I just had a question on this. And sputum purulence. And for this little, he's so crazy. You're an enabler. You're an enabler. Mm. The antibiotic regimen would be azithromycin. We're gonna put them on a macrolide. That's first line, boo. First line. When to be concerned, unintentional weight loss. That's always unintentional weight loss. Always gonna be first. If with COPD, dang, I can't see nothing. Lung cancer. That'll be a concern for lung cancer. Increased calorie burning due to increased work of breathing, so they lose weight. May need to increase caloric intake to balance out current nutrition deficit. Professor 89. What is 89? I don't know what that means. Increased caloric intake. And that's COPD, people. Asthma finna take me out, baby. I don't even know if I could put this is the next page. Yes, I'm left-handed, Quenisha. I mean, Daria, I'm left-handed. You know, I was left-handed. I know you left-handed. Ain't that something? I can't curse on my live, but ain't that something? That's all I say. Ain't that something? Ain't that sense? What that mean? What that mean? You always try to be mean and funny. Oh, I didn't go get them. Y'all probably got some. Y'all probably got some in that room right now. Probably about, babe, let's just go and get 3 dozen just in case somebody else wants some at the plate at the hotel. Probably what you did. That's probably what y'all did. Y'all probably, you probably, your husband probably drove the car and got however many he could get, and then you probably pulled up in the Uber. No, no, no. I know what y'all did. He was driving, and you was at the store, and so he went through the drive-through the first time. Then he came and picked you up from the store next door. And you drove through the drive-through again. He probably said, "Baby, whatever we'll eat, we can freeze them." Too funny to me, baby. We can freeze whatever we'll eat. We gonna freeze them. Oh my goodness, Quenisha, I ain't fool with you. Oh my goodness, they don't care, Derry. That's right up their alley. They don't care. That's exactly what they would have did. They still would end up with 4 boxes. Okay, that is so funny. You are too much. Mm, just too much. I know. Wouldn't even taste like that. Would taste like sweet paper by the time y'all ate them donuts. Mm, mm-hmm. Oh my gosh. So for lung disease, you have obstructive lung disease and you have restrictive lung disease. For obstructive lung disease, you have trouble exhaling air from the lungs, which is like I don't like that. asthma, cystic fibrosis. Restrictive lung disease would be trouble in lungs fully with pneumonia, TB, or pleural effusions. um, restrictive lung disease ain't no joke. We ain't talk about sarcoidosis. Don't they have to be on prednisone or something? I'm sorry. Could y'all get on here asking me questions? Get on here asking me questions in front of all these people. They already um talk about me in the comments in front of all these people asking me all that stuff. See, I have to have y'all in the unfiltered live because see y'all know how to act in this one. How that man did with that pen in his hand, that notebook. Period. When he was in the interview, he said, "Nah, shoot. Oh, I can get off my YouTube live, but since I ain't doing that, I might as well stay on. Obstructive lung disease. This is fun. This gonna take up all my little paper. Councilman Eric. No, 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 not Councilman Eric. I know y'all better pay attention. Okay, yes, Quenisha talk about she talking about the right man. I'm talking about the man he had to have the suit on outside. It was like probably already hot out there, and he had on that suit, and that hair was thick. But Councilman Eric will take a 5-minute recess. No, no, no. Well, y'all better focus. Let me show you who I'm talking about. Who I'm talking about, Darius. Dang, I can't remember him. Oh, here you go. Mr. Newsom.
Since we spoke last time,
Get back.
asking if anything changed.
Get back. Excuse me. This how I'm do y'all. Let me make sure I got the pen right. Oh, he had no pen. Dr. Newsom. Oh, no, I'm not. Get bike. Get bike. Dr. Newsom. Yep. Uh-huh. Hey, and the other one, when the bug fly and it hit him in his mouth or something, and he say this. I can't say it on my TikTok, but you know what he says. Country town. These folks know they be fun. T funny. Why am I like we have to take inactivity? And just be lying. I am moving. What y'all want me to do? You want me to dance? Anyway, Derry, that's not true. So you know how I don't know if you've been here since, but so we give Kofi his toy when company come around, and he acts so much better. He don't jump on people. He just Derry, I'm right-handed, but that's what I tell people who should know things about me. I lie to them. It's just inverted. I guess the image is inverted. This is my right hand. Cause you know the wall over there to my left side. So that's kind of confusing. But yeah, so Quenisha was like, she forget. So I was like, okay. I said she must forgot about Kofi. Clearly she forgot about Kofi. But Kofi wasn't in the front, he was in my room. But if Kofi hear the door open, of course Kofi gonna run. Kofi had his toy. I had given him his toy because I was gonna put him in his I must be lying. In his pen, whatever they call it, crate. I was gonna put him in his crate. Quenisha opened that door. I was at the I'm not laughing at you, Quenisha. I was I was like, no, and I was kind of looking confused. There, Quenisha was coming to the door. Kofi big ass ran. I mean, Kofi big self ran to that door to the door frame and stopped with the toy hanging out his mouth. Quenisha closed the door so fast. She hit her finger. I feel so bad about that. And I don't like that. That ain't funny. But the poor dog looking so confused. And then he was trying to stick his head out. Kobe looked so confused, like, what is wrong with her? And then he came to the door, like, he didn't even try to run outside. The door's open. He was scared. So then that poor dog was peeping, trying to peep out the door, see what was wrong with Quenisha. He trying to make sure she all right. She gonna close his head in the door. She closed that dog head in the door. I said, you ought to be ashamed. Peter. I need to call Peter on you because it seemed like the only person who got hurt was the dog. You hurt my dog. I thought you were just scared of other dogs. I didn't know you were scared of family. Yes, you did. I ain't gotta lie. I ain't gotta lie. One thing about it, I ain't gotta lie. You got me spelling exhale hell around. Yeah, I have the hardest time spelling asthma. Right, come from family. You ain't gotta act like that. You ain't gotta act like that with him. I said, get. He want foaming at the mouth. Maybe you was foaming at the mouth. He want foaming at no mouth. Get on here lying on him, okay? I probably did this one first. I don't write so hard. Oh, you can, but you can take me. You can. We can go. We can go. Because I can change all this information right now that I'm looking up instead in to law. I watch Judge Judy, Judge Mathis. I watch the fake judges. I do what I gotta do for mine. Judge Judy. Was that a subliminal threat? Is because that's what it sounded like. Say what you mean, say it with your chest. That's what she's trying to say. That's what she's trying to say. What invitation? You ain't invite me nowhere. There you go, lying. Them lies come so easy to you. Them lies come so easy to you. I don't see no invite. It's some dark facts. I wish I wrote like this all the time so I can actually read my handwriting, but I don't. I've been thinking all day. Trouble feeling long fully. It's restricted. We got pneumonia, TB, and pleural infusion. Reduce volume. Reduce lung volume. I don't know. When we going to brunch? When we want to do brunch? I don't know. I had to mark out so many words, honey, because people crazy. Don't know if you got it. When though? You mean like you gonna cook? You probably feel like cooking. I just like your brunch. I'm sorry. Long scarring causes stiffness. Okay, bingo. I just need a whole new sheet for asthma. I'm not even gonna stress myself out. There's no gram, but I'm not gonna write anything on the back of here except for extra notes. Yeah, I'll write extra notes on it because uh-oh. Okay. You want me to talk to you about asthma? Okay, let's talk about asthma. 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 Diagnostics. It's based on symptoms and spirometry. Spirometry is gold standard for COPD and asthma. Symptoms are recurrent episodic symptoms of dry cough, nighttime wheezing, and chest tightness. Spirometry is greater than 12% increase in FEV1 post bronchodilator. So that bronchodilator make that FEV1 greater than 12%. That's gonna suggest asthma. So test tip per I think the GINA guidelines have changed. That's the only thing about these tests is keeping up with the current guidelines. Oh no, it's right. So per the GINA 2020 guidelines, the ooh the LICS and LABA formoterol is now the preferred rescue inhaler. It used to be albuterol for forever. All through school, it has been albuterol. You got your albuterol behavior. Where your albuterol inhaler? Where your albuterol behavior? Inhaler. Where's your albuterol? You got your albuterol with you? Calm down, girl. I'm gonna have to draw this whole chart on my paper because I ain't gonna remember. It says forced vital capacity, which is the FVC. It's the total amount of air exhaled from the lungs. The forced expiratory volume is the amount of air rapidly exhaled in 1 second. Total amount, rapid amount. Forced. Is that it? Is that a good one? Why you ask me what I cooked? I cooked tacos yesterday. You must don't think I cooked. You must don't think I cooked. I did. I can do some respiratory questions because I feel about ready. This is the last one. I can do some respiratory questions real quick. I was gonna do neurology, but now I want to do these respiratory questions. Oh, but not for me. For Scarlett. You. What were they dipped in? Man, they got like 1,000 respiratory questions on here. 45. I'm gonna go ahead and pay barbecue. That stands for a big back queen. I'm sorry, I shouldn't have said that. I should have been a rapper. They probably don't, Quenisha. She probably just asked for it. Teacher, that's probably that's the what the people say the secret menu. Oh, I'm gonna try those tomorrow. Mm. I think they had one of the flavors I wanted to try. But you know what's good? That doggone potato, corn, and fried chicken bowl. Man, that tastes pretty good. Like a chicken pot pie, but it's not a chicken pot pie. But that's what it kind of reminds me of. Uh, oh, shoot. I ain't fooling with you. Oh, my goodness. I have seen it, but I think I wanted the pepper flavor. It's something like a sweet and sour. What they salty? KFC real hit or miss. 91 questions, bro. Ain't no way. I might just have to read through these. What is the recommended treatment for acute exacerbations of COPD? Is it still right? Short acting bronchodilators. Is that still right? Well, hit the hay. I'm sleepy too, but I'm probably gonna go to sleep. What time is it? 10:42. I'll probably go to sleep around 1. I'm finna switch over. I guess I'll go live on my other page. Good night, y'all. I don't know what's a two-ton, but I will still pray. I don't know what the two-ton is. That sound heavy. You gonna wake up sore. Oh Lord. You gonna be backing that thing up. Hello. Ooh, that thing heavy. Oh my goodness. People pay for that. They probably don't even think it's real. But you know what? That don't even look hers don't look like no BBL. You can tell it's real. Like it's just These are so crazy. I know people be like, I want mine just like that. But you know what? Some they can't do a doctor can only do so much. Yeah. You don't apologize. You just say anything. Mother live you was saying you ain't got on no women's wear. You don't apologize. You don't care. No decorum. No decorum. Be happy. You meow out in that L. Hmm. Boy. Oh, I just don't know. I just don't know. I don't even know what to say. You don't apologize. I gotta switch the lives over. I gotta go live on the other two pages now. Ain't that something? It's hard. I should have paid. How you do this? Good night. You toting the real 2 ton. Mm-hmm. 1 ton on the left, 1 ton on the right. I'm finna go. Let me finish. I'm trying to see something. Oh, I messed up. I don't know what I did. I don't even know. I don't know. Look at that one.
What if Anthony Hamilton sang Money?
Ah, Okay, like I can't go live on this one. I've been live on this. Try you live. I never seen one. Not for real. Maybe Raylan. They ate me. Oh, honey. Later on, in the beginning. Stay with me now.